Okay. Good morning. Welcome to the May 27th, 2021 COVID-focused meeting of the Needham Board of Health. I'm Rob Partridge, Chair of the Needham Board of Health. This open meeting of the Board of Health is being conducted remotely per the Governor's Executive Order of March 12, 2020, due to the COVID-19 pandemic emergency and is being recorded. Public access to this meeting does not ensure that there will be public participation unless required by law. Public comment at this meeting is not anticipated. I will introduce each board member and each participant on the meeting agenda. Please respond by saying yes when your name is called. Christina Matthews?
Yes.
Steve Epstein?
Yes.
Ed Cosgrove?
Yes.
Kathleen Brown?
Yes.
And we have also Carla?
Yes.
Tara Gurge?
Yes.
Tiffany Zeich?
Yes.
Diana Acosta?
Yes.
Hannah Whitehead?
No.
Lynn Sheff?
Yes.
And Carol Reed.
Hello.
I don't think I missed anybody. Okay, so with that, we can proceed. And the first item on the agenda is the COVID discussion. And we have a number of slides for that. And I'm not sure who will be presenting that. Is that going to be Hannah or Tim or Tiffany?
I think we'll all do a little bit, but Hannah is probably going to start for us. Since it's probably helpful just to briefly share my screen. I know the board has it, but since it's recorded for folks at home. So I'll start and jump in, Hannah and Tiff. So this is the risk level in the state right now as of the day that was released last Thursday. New data is released every Thursday evening. Needham is up very slightly from its level last week. It's still at an incredibly low level of average daily cases and at a low positive testing rate. Everywhere in the Commonwealth, except for 2 communities right now, is in the green or the yellow. Most of the areas around Needham are in the green, which is very positive. As I said, we're up just slightly. Last week we had 12 cases reported. This week in the 2-week period, 17. So a slight increase, but I don't think a particular cause for concern given the relatively low level and the testing rate that's also low. This slide, which Hannah put together, goes over the academic year breakdown, and you can see sort of the color-coded bars, which indicate the number of cases within each particular age band for each of the 2-week periods that are displayed. So we're down at a level, where we haven't been since September, or I guess October, really. It's highly positive. This is a new slide that Hannah put together that I really like, just showing the decline in cases and also the case distribution within the age brackets over the past 5 weeks. I think it's helpful and sort of tells a pretty clear story there. And this is also so some of this is contained in the previous slide, but I think this is also helpful just to see within particular age groups that we're focused on how the decline has gone over that period. Our average daily cases, this is from, basically when the state started producing this data, which is mid-August to present. And you can see Needham and the 5 communities we've chosen to compare ourselves with, and the average case volume. Here's Needham, just separating out all the other communities, just having Needham. That's where our daily case load has been over the course of this basically almost year-long period. And over the last couple of months, you can see the more clear trend of sharp decline. Incident rates by age. Right now, again, we would normally be concerned if we had particular groups that had a higher incident rate than the overall. But given the low level of average daily cases, I think we're not particularly concerned that there are some 20-somethings that, slightly more 20 somethings this week than last week that are in our COVID pool. The state and counties have mirrored the communities in terms of the decline over that period. The positive testing rate in Needham and surrounding communities has been pretty sharply down, and this is over the last 2 months. And countywide, same trend continues. Hannah and Tiffany, can you take over for vaccines?
Sure. Oh, go ahead, Tiffany.
No, you can go ahead. You did all the slides, so I'll just be here.
Yeah, I guess so. In terms of vaccines administered, obviously the bulk of this was done in March and early April, but the home visitation vaccination program has picked up a little bit in the last couple of weeks. So even though it's hard to tell on this graph, our total number of doses administered has been going up. I think, Tiffany, you can maybe remind me of the exact number over the last couple of weeks, but it has been climbing again.
Yeah, for the home vaccinations we've done, I think total they did 20 actual home vaccinations. Of the 100 people that were actually referred to us or called us, we only ended up doing 20 in the end. But yeah, and then we did a mini clinic, or we tried to hold a clinic, but it only ended up being 19 people. And then we did some walk-in appointments last week. So probably that would increase by another, I don't know, 10 or so, but not by too much more than that.
Tiffany, the reason we weren't able to 100 people registered for the homebound program, we were only able to do 20. That wasn't because we didn't feel like doing the last 80, right?
Correct. So it was mostly because of the pause on the J&J and then getting the Moderna from the state and how long all that took. A lot of them were able to find different resources to get it, a ride somewhere or something that allowed them to go get it sooner than we were able to administer to.
So unfortunate, obviously, that delay caused some people to not get the vaccine as soon, but a lot of them seem to take it as an opportunity to get a quicker appointment. So that's good.
Correct. And those that we did go do home visits for were extremely grateful for that opportunity. So it was good.
Great. Vaccine coverage, Tiffany and Hannah, if you can also tag team this.
Yeah, so I think we looked at this last time we all met, but I mean, the trends kind of have continued. Vaccination coverage is now over 3/4 of the town population, according to the census numbers that the state is using. Fully vaccinated is quickly approaching 20,000 people and is at about 64% right now. And the partially vaccinated proportion has been falling recently, indicating that more people are shifting into being fully vaccinated. And so this is just looking at vaccine coverage against our COVID incidents, and you can see kind of as one would expect, as our vaccine coverage has gone up, our COVID incidence continues to decline. Digging in by age group, even among 16 to 19-year-olds, we're seeing now that the vast majority have at least one dose. The state did start breaking it out by 12 to 15-year-olds and 16 to 19-year-olds. So we're able to look at the younger population's vaccination coverage in a bit more granularity now, which is great. And so now kind of looking more specifically at fully versus partially vaccinated. Fully vaccinated is clearly highest among the eldest age groups and kind of increases with age, and partially vaccinated is kind of following an inverse pattern to that. As 12 to 15-year-olds have only just been made eligible, none of them are fully vaccinated yet, but we'll be following that over the coming weeks.
Hannah, there are some discrepancies on that slide. If you look at the over 75, I'm not sure how 12% can be only partially vaccinated when the greater than 95% are fully vaccinated.
So that is a great point. And That's why, so when the state is putting out their vaccination coverage rates, they often use this greater than 95%. From what I can figure out, this has to be linked to like the population estimates that the state is using are probably slightly underestimates. So they're having, the actual number of people in the system as vaccinated is surpassing the denominator that the state even has as the town population. So yeah, I definitely, all of these percentages, I would say there's, an asterisk that they are potentially slight overestimates because of this kind of inaccurate denominator.
Can I ask, do we ever look at the town census? I mean, we collect that information every year. I wonder if we could get better estimates by using our own data for the denominator.
Yeah, that's a great point. We haven't done that yet. I've been, focusing on what the state has been putting out, but that is a great idea I can definitely look into.
We're going to see an even more glaring example, I think, in one of the next couple slides about the challenge with the state and census data slightly underestimating total population. This is a different way of looking at that, but this is the raw number, right?
Yeah, so I think kind of because of not wanting to rely completely on these percentages that the state is putting out, this is also just looking numerically, like by frequency of everyone who has been vaccinated, the breakdown by fully versus partially. So as you would expect in the eldest age groups, it's a pretty small number who remain just partially vaccinated. The vast majority have received 2 doses or 1 dose of the J&J. And as you get to the younger groups, the partially vaccinated is actually a bigger proportion. Yeah, so turning towards race and ethnicity, kind of the same issue. You'll see that some of these percentages don't add up. You can't have 93% of the Black population fully vaccinated and 31% partially vaccinated. I think that's the glaring example Tim was referring to. So I think, again, if we go to the next slide, this is looking just at frequencies, I think is a kind of more, it doesn't give us an idea of how many people in these groups haven't been vaccinated at all, but we can kind of see among those who have been vaccinated, are we seeing some disparities by race and ethnicity in terms of progression to becoming fully vaccinated? And so you can see that among the white population, the smallest proportion remain partially vaccinated relative to the other groups. I think, as I've mentioned before, we don't have like a breakdown by both age and race and ethnicity. So part of this might be, if some of these groups skew to a younger population, that could be responsible for that. This is just looking kind of overall at the race and ethnicity breakdown by fully vaccinated on the left, partially vaccinated on the right. You'll see we have kind of a decent number of other unknown. So we don't know exactly where that group is falling. The white population is higher or represented more largely in the fully vaccinated group, and in the partially vaccinated group, there's a slightly smaller proportion for the white group. Again, just looking kind of at the progression over time, most race and ethnic groups, we are seeing a pretty steady increase. Among the Asian group over the last couple of weeks, it looks like the rate of vaccination, fully vaccinated, has picked up relative to the other groups. You can see the slope is much sharper. And then this is just comparing our vaccination coverage to kind of the towns surrounding us that we typically compare to, as well as statewide. So Needham is the kind of navy blue bar, second from the left. Particularly among the younger age groups, we are outpacing the state and many of our neighboring communities quite significantly. As you get to the older age groups, this levels out a bit more. But I think just shows that Needham residents have been very successful in getting vaccinated. And this slide is just digging into the 12 to 15-year-olds now that they're getting vaccinated and we have data on them specifically. My understanding is that this might not actually represent all of the teens in Needham that have been vaccinated. I know there were there's a private pharmacy running a clinic, and I don't think their numbers are represented in here yet. So that will probably bump Needham up quite a bit. But even irregardless of that, disregarding Newton, we're pretty on par with the state and many of our neighboring communities.
Yeah, so I did touch base with that with Barbara Stern, mixing Alan and Barbara together, with Barbara at the school, and she touched base with PelMeds about that, wondering why, because we got a concern from Needham Pediatrics that they weren't seeing the kids who said they were vaccinated within the state system. So what response she got back was that they are lagging by almost a week. So they hope to have everybody inputted into the system in about a week. So we should see the true numbers in at least 2 weeks time at some point. I did just kind of reiterate it that technically it's supposed to be in within 24 hours of administration. So as fast as they can get it put in, so they're within the state regulations, would be good, but we'll see it eventually in a couple weeks.
Great, thank you both. Are there any particular areas there that the board wants to dig into?
I think we're really doing a terrific job. I've gotten comments from some of my public health buddies in other cities and towns wondering how Needham's done so well. So I got to give everybody, a shout out for the efforts that they've done.
Do we have any information on either vaccine hesitancy or difficulty getting vaccines for the 12 to 15 age group?
We do know that.
So partially the difficulty getting vaccines for the 12 to 15 age group, Needham has been working with PelMeds, a Needham resident, Byrne Patel owns PelMeds, which is a private sort of non-commercial pharmacy, a sort of a medical and compounding pharmacy. And he partnered with the schools. He had a meeting with the superintendent, the two principals, and with me, saying that he had vaccine available, Pfizer vaccine, which was useful at that time for the 16 to 18-year-olds. And then the day after we had our meeting, it was extended, the emergency use authorization was extended to 12 to 15-year-olds. So he has done and will continue to do with his staff and volunteers clinics. He did last weekend, I'm thinking at the Pollard, both Saturday and Sunday, a couple hundred people each day, which is great. And they have more clinics that are this weekend. So they're making a significant dent, and the school's partnership with them, I think, has borne fruit. Although, as Tiffany mentioned, we're hoping the data can be entered a little bit more quickly so it can more accurately reflect how many people in Needham have been vaccinated, because it is significant. Anecdotally, the high school principal did a survey of his juniors and seniors, and this is 10 days old now, but 56% of seniors and 51% of juniors had already been fully vaccinated. And so those numbers have only gone up since then. And that's a very positive sign.
Yeah, but how about the 12 to 15-year-olds? Because then you're looking at Pollard vaccination rate, not at the high school.
Yeah, we don't have any clue of that because essentially the PelMed data is a little bit delayed in the state system. So we don't have a sense of whether our numbers are comparable to Newton's or whether they're off. I would imagine that they're comparable, given that Needham is comparable in most categories to Newton. But right now, at least the data in the state MIS system shows a fairly stark difference.
Is there any, regional effort to get the Pfizer vaccine to our freezers so that we could use that for that age group?
So we can certainly explore more options. I think PelMeds has made a commitment to vaccinating the schools, and the schools are sort of proceeding. I don't know if there's too many people at the schools now who haven't been able to sign up. Between last weekend and this coming weekend, I think they'll have ended up doing another 12 or 1,400 first vaccinations.
Have they been making outreach to the kids who might be in some of the private schools as well?
That I don't know, and we could certainly follow up with that.
So I do know that they have, I don't know that PelMeds have, but all of the private schools have been in touch with someone about vaccinations. I don't know what they've decided to do, so we can double check on that, but I do know that they've all been in touch with somebody.
Because we had reached out to them, right, Tiffany, to say, you know, we could get vaccinated. Do you need help getting vaccinated? And they sort of all had a dance partner, for lack of a better word.
Do you think we should also kind of reach out to PelMeds and kind of encourage that they get those in the system as soon as possible?
So I'd need a contact because there is no way to get a hold of anybody on the phone.
Okay.
I did
I
try that.
can put you in touch. Yeah.
But we would need an email address would be optimal.
Yeah.
I do know the first weekend, one of their tweets, they said they did 722 at Pollard. So there's definitely some missing, and whether those were all Needham, I'm not sure, but there's definitely several missing.
Okay.
And this date's May 13th, so that was before both of their clinics here, right?
Mhm.
Yeah, so none of their numbers are in here. This
No,
is,
that was their first week. Oh no, their first weekend was the 14th, 15th. So yeah.
yeah, so that's what I mean. Like, I bet we're almost up at Newton's numbers because they did 700 a day, 2 days, right, at each school?
Yeah, I believe total the whole weekend was 722
Oh, okay.
around there.
But they did, oh, another one's this weekend, or didn't they do 2 weekends already? The high school?
Yeah, they've done 2 weekends. One at Pollard was the 15th, 16th, and the one at high school was last weekend.
Okay, so we're like probably another 1,500
Yeah.
easy. Mhm.
So if we have 12 to 15-year-olds who have either received a vaccine or the ones that want one have signed up, at least in the public schools, do we have an idea of what percentage of the total 12 to 15-year-olds that is? Kind of getting back to my hesitancy question, because I'm just wondering, you know, there's more hesitancy, I think, amongst parents wanting to vaccinate their kids. And I'm just wondering how that's playing out, if we have any idea.
So we don't per se with the 12 to 15-year-olds. We did do a vaccine hesitancy survey end of April, beginning of May, and closed it out just a couple weeks ago. So we do have that data, but at that point in time when we started the rollout, it was only for the 16 plus. It started the day that I think 16 plus could get vaccinated in Massachusetts, April 19th, but was open for close to a month. So we don't have anything more on the 12 to 15. And we do know we need to do a wider survey on that point as well. So we'll give it another couple weeks before we're able to start that, but we can definitely do something like that to see what there is.
That might be a good jumping off point to the slides on vaccine hesitancy. I'll share my screen again, and who's leading this section? Is it?
So I'm gonna go ahead and let Hannah lead the section. Hannah, and so the survey was done by Hannah Burnett and one of our student nurses, and then Hannah Whitehead and Jesse, I'm probably gonna say her last name wrong, Fuchs, went together and looked at all the information and did this for us. So I'll let Hannah speak to that.
Sure. In terms of survey background, Tiffany, feel free to jump in if I miss anything, as I think you're a bit more familiar with it. But I think, as was mentioned in the last board meeting, the survey was distributed through different community partners instead of directly through Needham Public Health, such as the Community Council, Needham Public Schools, Center at the Heights, the Housing Authority. And this approach was taken kind of with the hopes of capturing, a broader pool of respondents, including those who might be more likely to be unvaccinated, who may be, less likely to respond to a survey coming from Needham Public Health. So the survey was administered both online through Google Forms as well as paper-based surveys. I believe the paper ones were only for the Housing Authority. And yes, as Tiffany mentioned, this was done at the end of April, early May. And we got a total of 210 respondents. And just to underscore before we look into any of the results, this is not a representative survey. So we're not going to be drawing any kind of broad conclusions about what proportion of Needham is vaccine hesitant or anything like that. But I think it does provide a pretty valuable kind of snapshot and insight into how people are feeling in the community. So just to first look at respondents or the demographics of our respondents, you can see off the bat, it's obviously not representative. We have 3/4 were female, over 70% were 65 years or older. So this is clearly kind of representing a subset of Needham in terms of the bulk of our respondents. So in terms of how it broke down in terms of vaccination status, almost 90% of the respondents had already received the COVID vaccine. And then of those who had not, which was only 27 people, about half of them said that they would receive the vaccine once made available to them. And then the remaining 13 said that they would maybe or would not receive the vaccine once it was available. So those 13 were the respondents that we categorized as vaccine hesitant for our purposes, and then kind of wanted to look, what are their demographics? What are their reasons? So looking at the demographics, it's a very small number, so I don't want to over extrapolate from any of this, but half of them were white, which is low when you think about Needham's demographics overall. Half were female, 1/4 were male, and then 1/4 declined to respond. So kind of hard to tell the true gender breakdown. And in terms of age distribution, it was pretty kind of spread out. So not really concentrated in one age group.
Mm.
So then we wanted to kind of see, even though this is a very small subset, is this kind of differing in demographics from the much larger group of those who are not hesitant. So by race, I think it's quite interesting and kind of aligns with the literature on vaccine hesitancy that non-white respondents made up a bigger proportion in the hesitant group than in the non-hesitant group. So you can see among the non-hesitant group, over 90% were white, whereas among the 13 hesitant participants, only about half reported their race as white. Again, for sex, sex, similarly, much more heavily female in the entire sample and a lower proportion among the hesitant. Kind of hard to tell with the 1/4 of respondents who didn't respond. And then looking at age, the hesitant population definitely skews a bit younger. You can see in the non-hesitant group, over 3/4 were over the age of 65, whereas among the hesitant respondents, we see a bit more of a split between the 45 to 64-year-old age group, which I just kind of collapsed all of that together. And then about 40% in the 65 or older group. So we did ask them, what their reasons for not receiving the vaccine were. The survey allowed respondents to select as many responses as they wanted. I think most reported between 2 and 4 reasons. 2 of our hesitant respondents did not answer this question, so we don't have any insights as to their rationale. But the other 11 did, and we can see on this graph in the bottom half, of this slide kind of the reasons given in descending frequency. So the most common reason given was concern over possible long-term effects, followed by not thinking that COVID would make them severely ill, wanting to wait for more people to receive the vaccine first. So those respondents tended to fall more in the maybe category. And about a quarter were concerned with the immediate immune response, so kind of side effects that you would get with the vaccine. And then a few, reported having COVID in the past and didn't think that they needed the vaccine. So to split it down a bit more, obviously, again, these are very small numbers, so this isn't necessarily indicative of, the broader population, but kind of as you might expect when we look at those who responded maybe to getting the vaccine versus those who said no, they will not receive it, we are kind of seeing different reasons. So among the maybes, it's more common for them to report that they were waiting for more people to get vaccinated and being concerned with the short or long-term effects. Whereas among those who straight out said no, almost all of them said that they were concerned with possible long-term effects, and they were also didn't seem to think that COVID would make them ill. So yeah, I think, again, small numbers, this kind of just gives us a taste of maybe what's going on in terms of the rationale in the community. Next steps, I think it would definitely be great to conduct some wider surveys in Needham. Obviously, this skewed towards a much older population, which we know is already, the vast majority is vaccinated. So I think focusing on parents and young adults who are more recently eligible and getting a sense of vaccine hesitancy in that community will be very important. As well as, I think this gives us some important insights for kind of vaccine education and how to target our messaging. The fact that, many people, not many, but a portion of the more strongly hesitant respondents feel that way in part because they don't think they will get sick, maybe points to the need to emphasize herd immunity and kind of a community-based approach rather than just thinking about your own need for the vaccination.
Thank you. I think that's great.
And I just, with such a low response rate, I think it's really misleading to show those bar charts like as if they're equivalent sample sizes for one. Yeah. I would go with tables, like percentage, like pie charts where you have 1% Black, that was one person, right? Or maybe two. So some of these, I know it looks nice, but I'm afraid for this to get out into the public realm, people draw conclusions. So, sometimes you can do a bar chart and then like expand a section, and, you know what I mean? Stuff like that. So anyway, that's my only.
No, great point. Thank you.
Anything else? I know the board had been concerned or had questions about vaccine hesitancy. And as Hannah mentioned, we're not saying it's a statistically significant representative community picture, but it does give us some insight into the thinking of a portion of residents who are willing to respond. And we did push it out through as many channels as we could to try to get participation.
What's the thinking around not sharing it online?
So we touched base with the town about that and asked, and the thought is we weren't really looking for the people who are vaccinated. We're looking for those who aren't. And as you can tell, even out of 210, we only had 17 or something that weren't. So the concern was if we posted it online or on our COVID website, it's going to be those people who are more into what's happening with COVID than those who are concerned or not wanting to get the vaccine. The thought was they're the same people. Those who already have the vaccine are those who are the ones that are on the website looking and doing these kind of things. So they
Yeah,
got
or on
them.
the website, but maybe not, accessing things like the Needham page, where we have like 15,000 townspeople. I mean, I still think that that's a good place to reach people if you want. I know sometimes the engagement can be a little bit much with certain topics and things, but something like this, I do think we could. Yeah, I don't know. I mean, I guess there are people there who actually don't even live in Needham, so that's an issue. But I
Yeah,
wonder,
Needham
I
Facebook
do
group.
think sharing this on, yeah. What'd you say, Tim?
Yeah, for the Needham Facebook group, I know there's a lot of people who formerly lived in Needham.
Yeah.
I think there's certainly some things we could have done differently with outreach. I think we did make a real effort to try to reach those people who aren't as directly engaged with COVID news and information, because we made an assumption, which I think is a fairly safe assumption in this instance, that the people who are very engaged with COVID are also the people that are much more likely to be vaccinated. And as Tiffany highlighted, even with our effort to try to reach those who are unengaged by COVID or sort of removed a little bit from COVID, we still got a vast supermajority that were vaccinated. So I think we don't know where there are large pockets of vaccine hesitant people.
Mhm.
But it seems from all the data that's been presented that we don't have a very large percentage of vaccine hesitant people,
That's true.
which is fortunate.
Yeah. Yeah.
Tiffany, did you want to? I'm sorry, we were probably the next item on the agenda for the board, if there aren't any other immediate questions, is to talk a bit about the governor's orders, which go into effect Saturday morning and June 15th, and to consider whether the Board of Health wants to retain its emergency order, which is currently in effect through June 30th, which requires masks in a number of instances in which the state order would not require them. So the board could choose to retain masks in many cases where the state is not requiring it. I think for myself, I do think that it's worth discussion, but our volume of total cases is quite low. Our positive testing rate is quite low. Our vaccination coverage is very, very high, which to me says, if the state is using sort of state averages to make its decisions on what is safe and what is not, Needham has lower case rates, lower positive testing results, and higher vaccination rates, which to me means Needham is a safer place for those lifting of restrictions that the state has in place right now. But it is the board's decision, and if the board chooses to keep its order in place, or if the board chooses not to rescind its order, the order would stay in place and would last until June 30th.
But the governor's change also includes eliminating limitations that are placed on businesses, which is also in our order. So that would be part of the same discussion.
Yes. I included in the board's packet the press release, and this isn't necessarily directly related to the May 29th issues, but the June 15th issue. So there are certain, and they mostly affect government and the way government conducts its operations, but there are certain changes that were made possible through the emergency declaration that would lapse when the governor rescinds that declaration on June 15th. Governor Baker filed measures, including proposed legislation to extend those, which is currently under consideration on Beacon Hill. That's one of the things, for example, that allows the board to meet in a virtual context like this, as opposed to having, all board members and all staff physically present in a room. So that's consideration of that is underway. The select board is also considering whether to adopt either as a temporary or as a permanent measure, a virtual participation policy. Unless the select board adopts that, in normal non-COVID emergency times, boards have to meet in person, no matter what, to ensure public access under the open meeting law. If the select board adopted a virtual participation option, that would mean that the chair and at least 2 other Board of Health members have to be physically present in a room, but up to 2 other Board of Health members could participate remotely in a meeting and still be, voting members under the quorum. But as Rob, as you mentioned, the more immediate sort of issue is the Board of Health's emergency order, which mandates face covering in a number of settings in Needham, and also does include some restrictions on businesses that the state will be lifting effective Saturday morning.
So do board members have thoughts about our changing our order to be more in line with the state's guidance starting Saturday?
Yeah, I think that we should change it to be in accord with the state's guidance. It would just create, I think, needless confusion at this point, given the vaccination rate in town, you know, and the low numbers. I think that it would be a reasonable thing to do.
I agree. I think it's too complicated to, you know, fight battles one by one.
Yeah, I mean, I was thinking that we should rescind it, but we should still issue, you know, maybe an advisory or a recommendation. My particular concern there are, you know, the 0 to 15-year-olds who have not had a chance yet to obtain a vaccination, most of whom are not going to be able to obtain a vaccination at all. You know, it's relatively rare that those kids get sick, but they do. And so we may want to have a recommendation for mask usage, particularly amongst unvaccinated, while, you know, lifting the mandate on the rest of the population.
Yes, I agree with that too. I think we do need some communication around ensuring we keep our younger population safe.
So we're saying that 0 to 12 need to wear masks, and you're saying next year in school, even if we have 80% vaccination rate, you're talking about masking?
No, I think
I
was saying just like a public advisory, maybe, you know, rather
Correct.
than. Right?
I think the data aren't strong enough now to have a mandate, because we know that the rate of illness, you know, of serious illness in those younger populations is so low. But I think that we may want to have an advisory or recommendation rather than a mandate. But I think we should drop the mandate at this point based on the data.
It would be in line with at least what CDC is saying right now, which is that it recommends unvaccinated individuals continue to wear masks in indoor settings until they get vaccinated. So that would sort of follow state and federal guidance, I believe.
Yeah, and that also might provide an incentive for people to get vaccinated too.
So in this instance, would we want to highlight the age group, or would we want to just say that unvaccinated people should still wear their mask in indoor settings if they can't be vaccinated or they haven't been vaccinated?
I think we should just make it generic like that.
Okay.
I agree.
Yeah, but I was thinking that perhaps from the, you know, public health division, you all could, you know, issue some sort of advisory or communication around, you know, just like a reminder that, you know, we still have a lot of, you know, our young kids who are not vaccinated.
Maybe to say something like unvaccinated, you know, including, you know, people age 0 to 12, you know, people who are immunocompromised, you know, or at higher risk. Kind of spell those groups out so they're sort of highlighted and that they would have the advisory.
Okay. Diana, did you have your hand raised?
Yeah, I was going to say the state, I have to look it up on the website, but they already have a statement about unvaccinated people still recommending them wear their mask inside. So I don't know if we just want to copy that, but have it coming from the board, because they already have a statement out there.
Okay. We could
agree. I think that just whatever the state says, and go with that. Mm-hmm.
I can put the link, I'm looking it up and I can put it in the chat, but there is, because I looked at it yesterday for a resident who was asking about having Boy Scout meetings. So I was like, oh yeah, this is what they say, still recommending anyone who's not vaccinated continue to wear a mask indoors and where they can't socially distance. And it's already published on the state website.
Right.
I don't think there is a chat option. in like the
Oh, yeah.
Yeah, you
webinar.
could put it in the Q&A option and we can take a look at it there.
Yeah, that'll work.
How do you put that? It says open, doesn't say that I can add a link, but it's mass.gov info-details. COVID-19 mask
Yeah,
requirement.
it's if you go like for the reopening website, so you go like from mass.gov and then you go into the reopening Massachusetts part.
Yeah, we could send that to the board, but we could certainly sort of issue a statement where we sort of reiterate the guidance from state and federal authorities. Maybe we do a sort of a press release or a little announcement on the website that the board has, if the board does choose to rescind its order, which it would have to take an affirmative vote to do, then we could say, the board voted to rescind its emergency order, but does caution residents to please follow the following advice, or please consider the importance of masking in indoor settings if you haven't been vaccinated.
Yeah, I think that's good.
Because it says the Department of Public Health will issue a public health advisory effective May 29th that advises all unvaccinated residents to continue to wear face coverings in indoor settings and when they can't socially distance. So, right there. And then they have the advisory that's more detailed.
Great.
Okay, and as part of our order, then we will also eliminate our previous limitations on maximum occupancy in businesses.
Like Vinny, I think it's unfortunately, I think it's early to do that. I would want to see it like another month elapse, honestly, but I think that the confusion surrounding that is not going to be worth it. I think we are going to need to lift that, and most people are going to have to make decisions for themselves on that basis. Given that the vast majority of our population, at least, is vaccinated, particularly those that would be going into businesses and restaurants, largely not children, I feel reasonably comfortable with that.
Sure.
Okay, again, recommending that those who are unvaccinated would be advised to be masked.
Absolutely.
We'll also want to remind them that there are settings that are required still, whether you're vaccinated or not. So we'll try to add that in there or put a link so they can see what those are.
Yeah. If people want to see it, I have it up on a website. I mean, I can share the screen if people actually want to look at that, since we can't share the actual site. I'm sure Diana could do that as well.
Sure. I think I think you can share now, Steve.
All right, so if everybody can see this is the site. So, and scrolling down, here is effective May 29th, mask requirements. So public and private transportation, inside K through 12 public schools, which is kind of interesting because frankly, I think that, given our rates, I'm hoping that we'll do this through the end of the year, but high schools, I'm hoping in particular, that's not going to be required in the fall. Childhood programs, healthcare, congregate care, healthcare, and home care workers. I mean, you kind of heard all of this.
Right.
Okay.
So if the board was supportive of it, I think what I would probably need is the board, someone on the board to make a motion, or the chair to entertain a motion to rescind the board's current emergency order, and to ask the Public Health Division to issue an advisory or a statement sort of encapsulating what we just discussed, that while the emergency order is rescinded, it's still advised that unvaccinated individuals wear masks, and even if you are vaccinated in these particular settings, you still have to wear a mask.
All right, I'll make that motion to rescind our current order and to ask the board to, I forget how you worded that exactly, but according to the wording that you just gave us.
Sure, but we would have the statement would be from the board, but you would basically, you've given us the substance of it, and we'll sort of make sure the details are right and put it on letterhead type of thing.
Okay, I'll make that motion.
I'll second.
Okay, should we take a vote on that motion? Kathleen,
Yes.
Christina,
Yes.
Ed,
Yes.
Steve,
Yes.
and Rob is yes.
Okay.
Motion passes. And effective date, May 29th, I guess.
Yes.
Yeah.
Okay, great.
Great. Okay, with that done, got a few minutes. I think, is there any other discussion on that before we move on? So the last item is the school-based vaccination program.
And so I think we touched on it a little bit actually, or we touched on it pretty in depth on the vaccination slides. So that was going to be an update to you that working with a private pharmacy that a generous Needham resident helped set up a connection with the Needham schools and has done 4 clinics so far vaccinating younger high schoolers, predominantly freshmen and sophomores, as well as middle school students. So that was just going to be the very brief update on that, but we sort of got into it in the slides and looking at the disparity between Needham and Newton on the 12 to 15, which we think is a statistical sort of anomaly because of the lag in data reporting.
This might be a good time to bring up, one of the things that came up at Health and Safety on Monday, and that was kind of the question about what to do about surveillance in the schools in the fall. I think they'd be looking for a recommendation from the board as they, to inform them as they make their decision about what to do. So not something we need to discuss at all now, but just to think about going forward.
Sure, and I don't think it actually hurts briefly. So Kathleen and I are on the working group that's looking at testing, along with Mary Lammy's the lead, she's the assistant superintendent. Barbara Singer's in that group, I believe, and then I think there are 2 other teachers, a high school teacher and a elementary school teacher, I believe, or maybe middle school and elementary. And I think we were looking at, what options would be available. Currently, the schools have a pooled testing program for staff, where participation has dropped off considerably as people have gotten vaccinated. So with the sort of protection or the reassurance of vaccination, participation, which is voluntary, has really subsided to the point where, the results aren't particularly useful. I think, Kathleen, I'd love for you to jump in, but I think one of the thoughts is maybe pooled PCR testing is not the way to go. And so rapid diagnosis antigen, like a Binax Now type test, might make more sense, is one of the sort of current thoughts.
Just time consuming. So I do think that there's some movement to try to push DESI right now just has this, everybody puts one swab in a tube and it goes off to the lab. And then you have to run get a positive pool, you have to run everybody down. So I think what they're hoping is that there are some services that can resolve the pool at the lab, which is what we're paying out of pocket for the staff, right? The town is already doing that. But I think they're hoping to get cheaper options through the state. The problem with the Binax is it's time consuming, right? It's 15 minutes per kid. There are school districts around the country that are using it solely as a screening. The data's pretty good. You're finding more of the infectious cases. I know this isn't medical diagnostics, right? This is trying to figure out who's going to cause more cases in your school, right? So, that's kind of where we are. We'll say a lot of these pool testing programs, the participation is declining. I know in Wellesley's recent Board of Health meeting, they discussed, suggesting they end their testing program, since, as the infectious disease doctor said, it was causing more harm than good, because you're isolating people who, don't need to be isolated. And some of these pool testing programs are petitioning the state to not, even if you're in a positive pool, don't quarantine, send them to school, but Binax them every day until you get a hit. So it's like, then why test in a sense if nobody's getting it in school. So, I mean, there's just a lot of things. I think right now it's like a little bit in a holding pattern to sort of see how things go. I think it only makes sense really to test K through 5, given the vaccination rates. Wellesley did decide to continue their program for the rest of the year only because they had prepaid for all their tests. So they have like 3 weeks left. So they're still going to do it. And their participation has stayed pretty high. So other communities lower. So anyway, that's just a quick. Sorry, Carol, did you have a question? Or sorry, Rob, you can take it.
Sorry, I was just going to say, if you're interested, one of our Board of Health members is a nurse practitioner. She's our school nurse leader in Medfield. And if you would ever be interested in hearing from her, they featured Medfield in the news, but the success is due to her commitment and her high participation rates with students and staff. And I'd be happy to ask her if she could come and if you wanted and talk about the Medfield program. Pool testing, and they started with Abbott months and months ago. And do pool testing, all middle school and high school, and I think they're doing it grade 5. Just an offer.
Okay. I mean, I think if we decide to go ahead and recommend that, it would be helpful to have her inform us. Okay, other thoughts, comments, business? So our next meetings are June 9th at 9 o'clock in the morning and June 23rd also at 9 o'clock in the morning.
So are we going to continue to have the COVID-19 specific meeting, or do we want to discontinue that at this time?
I thought that at our last meeting, we had decided that we would continue it through June, which was already scheduled, and then discontinue the COVID specific meeting after that each month.
Okay, thank you.
And Mr. Chair, if it's okay with you, I'll distribute a survey to the board members to try to set a time for one meeting in July and one meeting in August. Historically, the board did one summer meeting, but given that we're going to go from, there's still some concern for COVID, it seems like going a month and a half between meetings would be a little bit much.
I agree. So yeah, please do that. Thank you, Tim. Okay, and with that, a motion to adjourn.
So moved.
Second. All in favor, Kathleen?
Yes.
Christina?
Yes.
Ed? Steve?
Yes.
And Rob is yes. Okay, we're done. Thank you very much, everybody, for your time.
Thanks,
Thank you.
everyone.
Have a good weekend.
You too.